Welcome back to my channel, The Medical Madam. In this video, we are going to be talking about progesterone, specifically the importance of progesterone through the perimenopause and post-menopause phases of life. These two phases are extremely important to talk about because perimenopause on average lasts 10 years for a female, and the postmenopausal phase is 12 months after your last period through the rest of your life. I'll be talking about the different types of progesterone replacement therapy as well as labs, so how to monitor what are the safe and effective ranges that we are targeting. First things first, we need to understand the role of progesterone in the menstruating female body so that we can understand how this hormone ebbs and flows throughout the monthly cycle. Stick with me, this is going to be quick. The role of progesterone is to prepare the uterus for the implantation of a fertilized egg, and it also helps to keep the cervix closed, giving that egg more time for implantation, and also holds the fetus within the uterus once you become pregnant. During the first half of the menstrual cycle, called the follicular phase, your progesterone is mainly made by your adrenal glands. These are the two small glands that sit on top of your kidneys on either side deep in your abdomen. During the luteal phase, which is the second phase of the menstrual cycle, your progesterone is mainly made by your ovaries. And the amount of progesterone that is being made is now about 10 to 20 times higher than it was during that first phase. This is why it's important when we test to test progesterone at its highest. This means that we are looking at progesterone during your mid-luteal cycle. So during that second half of the cycle, when your levels are 10 to 20 times higher than they were originally, you are going to create this arc of progesterone. And that drop of progesterone that happens at the very end of the luteal cycle is what triggers menstruation. So we're looking to capture progesterone at that peak, which is typically a mid-luteal phase level. Estrogen is also close to its peak during this time, so it's a great time to test both hormones to try to see the relative amount of both at their max. So what are some symptoms of progesterone deficiency, which would be why you would use progesterone for hormone replacement therapy? All of these symptoms are true for both premenopause, perimenopause, and postmenopause. Breast cysts, ovarian cysts, and fibroids. These are all symptoms of deficient progesterone levels. These are also symptoms of high estrogen levels. So if you have normal estrogen, but your progesterone is low, you are estrogen dominant because your estrogen is still relatively much higher than it should be in relation to that progesterone. Muscle tension, anxiety, and nervousness. Estrogen increases alertness in the body, and progesterone helps to calm the nervous system. So if we have a low amount of progesterone, you're going to feel more of that alertness, which often feels more like anxiety and tension in the body. On the flip side, if you have normal progesterone but high estrogen, you're going to feel the same thing. PMS. So PMS, even though it's a premenstrual syndrome, a lot of these symptoms are very, very common in postmenopausal women. Women will come to my office and say, I am so quick to anger. The smallest thing happened and my reaction was so out of proportion to what it should have been. And so this is a symptom of low progesterone. Low progesterone increases irritability and quickness to anger. On the flip side, low estrogen contributes to depression. Pain. Low progesterone increases your sensation and awareness of pain, making pain more painful. And sleep. Insomnia, racing mind, having nervous or tension in your body when you're trying to sleep at night, these are all symptoms of low progesterone levels. These sleep symptoms are especially common during perimenopause and postmenopause. So how do we measure your progesterone level to figure out if you're actually deficient? If you're a menstruating female, even if you're in the perimenopausal period, it's optimal if we can try to figure out how long have your cycles been and then figure out when that mid-luteal phase is going to be, and that's when we want to test progesterone. So if you still have a 28-day cycle, you can still be in perimenopause. If you have all these other symptoms going on, that's a sign that you might be in perimenopause. So you're going to try to test your progesterone level around day 21, which is going to be peak level day for you. If your cycle is a little bit shorter, maybe it's around 25 days, you want to test that progesterone level around day 18 or 19. If your cycle is longer, you're going to test a little bit further out. You know, if your cycle is like 35 or 36 days long, you're going to want to test around day 25, 26. So it's all relative to what's going on with you. The other thing to take into account here is that our cycles do change every month. Just because one month it was 28 days and you ovulated on day 14 exactly does not mean that that's going to be the same thing for the next cycle. Your hormones do fluctuate based on your stress, how much sleep you're getting, a lot of different factors going on with you. So this is not an exact science. This is like a best estimate. A day 21 progesterone level for a menstruating female, so someone who still has a period, should be between 41 and 73 nanomoles per liter. Your labs might also specify this in nanograms per milliliter, in which case you want your levels to be between 13 and 23. If you are postmenopausal or you haven't had a period in several months and you think that you are entering that postmenopause stage of life, it does not actually matter what day you test your hormones on because you are not having as big of fluctuations in hormone levels. You still do have some fluctuations, but it's not as drastic. An optimal level of progesterone post-menopause is between 4.8 and 25 nanomole per liter, or 1.5 to 8 picograms per milliliter. So when we are using hormone replacement therapy for a postmenopausal woman who's no longer having a period, we are looking to get your progesterone level into that optimal range for postmenopausal women, ideally on that upper end of the range. It's actually okay if we go a little bit higher than that. We just want to make sure that your hormones are balanced with estrogen. Hormone replacement therapy with bioidentical progesterone is extremely safe. I want to take that Women's Health Initiative study information out of your brain. That was all done with synthetic progestins. Synthetic progestins are actually made from testosterone, and then the molecule is slightly altered. This means that that progesterone molecule, this progestin molecule, does not actually look like regular progesterone to the body. It is synthetic, okay? So it's not a biomimetic hormone. Synthetic progestins are associated with a higher risk of breast cancer, especially when you combine them with an estrogen replacement therapy, specifically the synthetic estrogens and the conjugated equine estrogens. These are all of the hormones that were used in that Women's Health Initiative study. There is not as much research on bioidentical hormones, partially because there's not as much money in it. So progesterone can be taken orally. It can be sublingual, which means it dissolves under the tongue or it melts under the tongue. It can be used topically on the skin, and it can be inserted vaginally. So it is a topical application to the vaginal mucosa. In an oral form, the oral micronized progesterone is the safest. This is the bioidentical form of progesterone. As a topical, you can have micronized progesterone suspended in a cream, and this is what you're applying topically to your skin. It's also what you would use intravaginally. The sublingual forms are put into a lozenge-like application that is going to melt over time. And again, that is the micronized progesterone, so it is bioidentical. The other forms of progesterone are called synthetic progestins. As far as we currently know, bioidentical progesterone does not actually increase your risk for any cancers or long-term diseases. That being said, research is more limited on bioidentical hormones, partially because there is not the profound amount of money in the industry. During the perimenopausal period, if we are using progesterone replacement therapy, we are typically trying to use this to mimic a normal cycle, which means during that first phase of your cycle, the follicular phase, we are not using any progesterone because typically your levels are low. We start to take progesterone around the time of ovulation when your levels would start to increase, and you continue taking that until about day 28, which would mark the end of your cycle, and then day 1 is when you would, in theory, start your period. So we are using this bioidentical progesterone to mimic the normal increase and drop of progesterone. After menopause, if a female still has her ovaries, she still has the ability to make a tiny bit of progesterone. So what we do in this scenario is we use oral or topical micronized progesterones on days 1 through 25. Upon stopping that progesterone around day 25, that would be your natural 5 to 6 day period when your levels would have dropped off and that menstrual cycle would have occurred. Progesterone replacement therapy should not cause you to get a period. If you are experiencing vaginal bleeding after you are in the post-menopausal phase, you need to go and speak to your doctor. Your dose might need to be changed, but there might be more investigation that needs to happen because that bleeding could have happened for another reason. Some females, both before they go through menopause and after menopause, end up on progesterone every day of the cycle. They don't end up taking a break or mimicking that natural change. This is especially common for women who have a lot of difficulty sleeping. They suffer from insomnia. Women who have anxiety, and women who have estrogen dominant conditions. And this is because we're trying to balance out that hormone imbalance as well as balance out the biochemistry in the brain, specifically with the nervous system, because progesterone has an amazing calming effect on the brain. It's also anti-inflammatory to the brain. When using progesterone replacement therapy, it is important to monitor your levels. Although blood levels are just a snapshot in time, they don't actually provide the best picture of what your circulating levels consistently are in your body for progesterone or estrogen. They are extremely important to get because they do ensure that we are within safe ranges for progesterone and estrogen replacement therapies. Since the body absorbs micronized progesterone differently depending on how it's applied, whether it's oral, sublingual, topical, or vaginal, it may alter what lab reference range your physician is looking for you to be in. But in general, we are hoping for you to be in that upper end of the postmenopausal range, and so long as it is balanced with estrogen. We're always looking for a balance of all three hormones because they all work together. Estrogen and progesterone specifically have effects of this balancing seesaw where one will cause one symptom, the other causes the other. So like I mentioned, estrogen causes alertness, progesterone helps to calm the brain down. So they balance each other out really well. Estrogen promotes water retention in the body, specifically the breasts and the uterus, and progesterone has a bit of a diuretic effect, so it helps to balance that out so that you don't feel too bloated or swollen. This is another reason why you want to avoid the synthetic progestins. Because they're derived from testosterone, they often do not have those benefits that a micronized progesterone will have because they're not actually the natural form. And testosterone on its own can promote more irritability. It can also promote water retention, more specifically in the feet and ankles, but you're not going to get as much relief from a synthetic progestin as you will from a micronized progesterone. The best time to start hormone replacement therapy with progesterone as well as estrogen is going to be in perimenopause or as soon as you finish having a period and you are transitioning into that postmenopausal phase of life. This is because these hormones are extremely protective to your body in different ways. And so the longer you go with having a really low level, the more damage is going to happen in your body. So low estrogen is going to contribute to your risk of cardiovascular diseases because estrogen is extremely important for the cardiovascular system. That includes blood vessels in your brain, so your risk for things like dementia and other vascular related conditions. It is going to impact your bones and your bone loss. It's going to impact your skin, specifically your laxity and collagen production. Progesterone is going to have a major impact on your sleep and have that balancing effect to estrogen so that you don't become estrogen dominant. Testosterone, we didn't talk about testosterone in this video. I'll have to put out another video on that. But testosterone is also extremely important for your cardiovascular system, for your structural system, so your bones and your muscles, preventing bone and muscle loss, as well as your libido, ladies. And testosterone is super important for your metabolic system, so preventing things like diabetes. Testosterone is super important. And again, you don't want that level to be too high, but you also don't want it to be super low. So to recap here, you really want to start that hormone replacement therapy as soon as your hormones start to get all wonky or you stop having a period. If you have a hysterectomy, especially if your ovaries are removed, you no longer have that mechanism that is going to make your own progesterone and estrogen, which means you need to be taking that as a replacement. So Estrogen and progesterone are extremely important to your health, not only how you feel today, but how you will age in 20, 30, 40 years. So I want to encourage you to find a physician who is knowledgeable in hormone replacement therapy and get started on whatever you need based on your symptoms or your lab ranges and whatever your risks are according to your family history. Progesterone replacement therapy is not safe for everyone, even though it is in general considered to be very safe. There are always exceptions to the rule. You can get too much progesterone, and you will often feel it in symptoms such as bloating. You could have a lot of breast swelling, even breast enlargement and tenderness. Weight gain is really common after you've been on too high of a dose of progesterone for a prolonged period of time, and mood changes. And lastly, obviously, before using progesterone replacement therapy, you really need to be discussing your whole health picture with your physician. It is important to note that your need for hormones changes, even post-menopausal. So you might start off, a year or two after menopause, you might be on 100 milligrams of an micronized progesterone, and in a few years that might need to be changed. It might need to be increased, it might need to be decreased, but it does fluctuate. So just because you are given a certain dose and you're in a certain phase of your menstrual cycle, whether that's you're still menstruating, you're in perimenopause, or you're postmenopausal, does not mean that that is going to be the dose that you are on for the entirety of that phase of life. And that's it. I hope you enjoyed this episode of The Medical Madam. If you liked it, please give me a thumbs up, and I'll see you next time.